Okay, here we go.
Good afternoon, everyone. This is Ruth Christopolsky, Senior Vice President of Population Health for Atrium Health, and we'd like to welcome you all to our COVID Safe for School Town Halls. This is part 2. I think we have a really interesting agenda for all of you today. Dr. Louis McCurdy, who's our Specialty Director for Infectious Disease, is going to do a question and answer. Dr. Lynn News, who is our Specialty Director for Pediatrics, is going to talk about communicating with masks and some considerations during the flu season. And Dr. Hassan, who's a child and adolescent psychiatrist with the organization, is going to talk about childhood well-being during COVID-19. So really excited about our agenda today. I did want to let you all know that this meeting is being recorded and will be available along with a copy of the slide deck on our webpage. The webpage is atriumhealth.org/schools. And there are other resources actually available at that same webpage that you have access to at that website. We also have live set of resources that have both teacher and staff guidance, some student education, things like proper mask wearing, hand washing, symptom charts, as well as a digital guide to help schools reopen. So articles on preventing spread, managing stress and anxiety, and addressing school-based exposures. We are open to including any additional information that you might need. So please let us know if there's anything you'd like to learn more about, and we'll make sure that we add that to the online resources that we're making available to the community. And so without any further ado, I'm going to invite Dr. Louis McCurdy to the table. And he and I are going to do some questions and answers on treatments, testing, and guidance. And it's always very interesting. So welcome, Dr. McCurdy. I'm hoping you're well on this first day of October.
Yep, good afternoon, and thanks for having me.
Sure. So let's talk about our favorite COVID subject, which is testing. And as we all know, we're hearing lots of information in the media and the press about new tests. And one of those, Abbott's BioNext rapid test, seems to be a game changer in terms of affordability and speed of results. How can someone access the BioNext as a testing option?
Yeah, so as each day passes, and can't believe we're already to October, there's new testing that seems to be coming out every week, if not daily. And so the Abbott BioNext Now is one that's been in the media a little bit about its benefits as far as potentially being super cheap and then getting your results right away. The challenge is that sometimes the media news and what's realistic aren't matching up that well. So right now, we're not able to sort of access the BioNext Now based on some sort of rollouts and some government purchases. This isn't anything that one can get access to at Atrium or elsewhere at this point, just because of the way it's being rolled out. So I think as we look at these new tests that are sort of hitting the media and we get information about them, it is one thing that we have to think about is that all these tests aren't necessarily available at sort of a commercial level at this point, and we have to really sort of assess how these tests can be applied at our community level.
So thanks for that answer. Another thing we're all hearing a lot about in the press, particularly as the NBA was playing, were these saliva-based tests that have emergency use authorization. So I was wondering if they're a more reliable and affordable option than other tests that use nasal swab for collection. Can you answer that question?
Yeah, so again, it's another great question, and certainly an option that people are really looking into. I think for all of us, our goal is to be able to have more accessible testing, quick results, and then reliable results. And so I think those are the things that have to be balanced as we look at all tests that become available. So again, for saliva tests, one of the intriguing pieces is it is potentially easier to obtain. And so there are even some saliva tests that have been talked about in the news that you can do at home and then have a sample sent in. We hear about these in colleges that are using these different salivary tests for diagnoses. And so again, sort of thinking about ease of getting the test, so saliva certainly provides that opportunity, but then we have to talk about sort of the reliability of the test and then the speed of turnaround. And so with most of the salivary tests, they're still PCR based. And so there's some logistics about how do you take saliva and then be able to test PCR. So that's very limited in actually where these tests can be done, which sort of labs. And then also that is a PCR test, which is sort of what we think of as the gold standard with our nasal test. And so these tests, again, are a little bit different than even the Binax Now in the sense that they can take time to get the result back. And then the last piece of that is how reliable are they? And so there's multiple studies being done. Yale has come out with one of the first salivary tests. And so again, depending on sort of which study and which type of persons you're testing in, there's some sort of variance in how reliable these tests are. And so when we talk about reliability, we talk about sensitivity of the test, the ability to pick up someone who's positive, and then also the specificity of the test, which tells us, hey, if we get that result, is it an accurate result or not? And so again, with these tests, there's some variability in those performance characteristics that we're seeing. And so right now, we don't feel that, certainly at Atrium, we don't have a saliva test that's appropriate to be run that provides a more rapid result and a better result. So that's sort of the summary so far on the salivary test.
So thanks for that information. I know that you and the team, both on our laboratory side and our infectious disease specialists, are looking at and continuing to monitor what's out there. So we'll keep watching, and then hopefully we'll have some additional news on new options as we go further into the fall. Another thing we wanted to do was just do a fact check and about some guidance on some of the statistics that we're hearing. And so there have been reports in the media that only 6% of the deaths attributed to COVID-19 were actually caused by COVID-19. Is that a true statistic?
No, I think, the challenge with all of this is there's, trying to define exactly what's related to the virus, and then some people who are, trying to understand the global impact. And so when we talk about people with coronavirus who get infected, a lot of the disease that we see after the virus is the impact on our organ system. And so with any infection, where there might be pneumonia related to a bacteria, or maybe related to a systemic bacterial infection, or even a viral infection, what's caused by the virus itself immediately versus what impact that virus has on the body and then leads to the mortality or the death of that patient, can come into question. But what we do know about the coronavirus is it clearly causes a disseminated illness, meaning that it affects multiple organs in the body. And so when people are having mortality or death related to the virus, it can vary on what that is. Obviously, the majority of that is related to respiratory illness and difficulty breathing and low oxygen levels. But we also know the virus can impact the heart. We know the virus can cause strokes. And so there can be some discrepancy in how this is sort of labeled, in the sense of, oh, so-and-so died of a stroke. That wasn't related directly to the virus itself. But from my perspective as an infectious disease doctor, what we know about sepsis is when people have overwhelming infection, is that the pathogen or the microbe or the virus in this situation that's causing the illness, while that may go away in a few days, or maybe we'll even come up with a treatment that treats the virus, what we're left with is sort of the downstream impact of that virus on our body. And that's really what we're seeing with the death in this, where we're seeing respiratory disease that leads people to where they can't oxygenate, or we're seeing someone who have heart attacks, or what we call myocarditis, where the virus infects the heart and the heart stops beating, or even strokes. So, from my perspective, these are causes from the virus that are leading directly to the death. And while we can say the virus is causing death itself, I think that's sort of semantics in a sense. But, the virus is clearly deadly and causes significant organ damage to our bodies.
Thank you so very much for that clarification. So now to some positives. So we want to talk a little bit about treatment. You know, we're hearing a lot about convalescent plasma. So what is it? And who can donate it? And if they can donate it, should they? And how does it protect someone from getting COVID-19?
Yeah, so convalescent plasma is essentially taking the blood from someone who has had the illness and then convalesced. And so they've sort of gotten through the illness and survived. And what we know is the majority of the patients who have the viral illness develop antibodies. And so what we're doing with this is basically taking blood from people who've been through the illness and sort of got to the other side, and then taking their blood and looking to see if they've developed antibodies or not. And so what we know is in viral illnesses, antibodies are one portion of the immune system that can be protective. And so when people develop antibodies and we can measure it in the blood, we take that blood, we match it to the person who's now sick in the hospital setting typically, and then we can transfuse that blood and hopefully provide the now sick patient with some immune protection. We know that obviously people are giving blood who've survived, so we know that the majority of people develop antibodies, but we don't develop antibodies to somewhere between 8 to 14 days after the initial illness. And so there is some initial data, and so now it's being provided under what's called emergency use authorization, the convalescent plasma, that is, that if you give that to people early enough that you may be able to improve their outcome. And so the people who can donate are people who have had the illness and again gotten better. So you have to have a positive test. It can't be that you thought you had the illness because I feel like I had the symptoms of COVID. You have to have a positive test and then have improved and be about 2 weeks or more out from the initial illness. And so I would recommend anyone who's been infected to certainly consider this. I think it's a way to give back to the community. It's a way to potentially help someone else who's suffering through the virus. And the best way to do that is locally, it's called the One Blood, which is an organization where you can go on their webpage and make an appointment. They have questions, frequently asked questions there that you can get answered. And so I would recommend anyone who has survived the illness to look at that as an option, as a way to help other people who may be suffering. You know, and how that works again is it protects people by giving the antibody to the person who's sick before they have developed the antibody themselves.
So thanks for that. I know there's a lot of information in the press around other treatments or potential treatments. Can you talk a little bit about what are some of the most promising treatments you've seen so far?
Yeah, so there's a lot going on. The fortunate thing is here in Charlotte and at Atrium Health, we've been able to participate in a lot of these promising treatments. And so currently we have 5 inpatient trials going on that are looking at different options for treating the virus, and really exciting. We're about to open up outpatient trials for this as well. So some of the treatments are very similar to remdesivir, which is one of the antivirals that we've had available to us very early on in the disease, which treats the virus itself. And so there are now oral antiviral therapies that we have access to that we're studying to see if they're beneficial as the intravenous form. Again, one of our outpatient ambulatory trials is going to be looking at remdesivir in patients who are at home before they get to the hospital, which is the only place that we're giving treatments now. And so we have the antiviral medicines, we have some anti-inflammatory medicines or drugs that are coming out, which again, what we know about this disease is the virus elicits an immune response, which sets off an inflammatory state within the body. And that's actually what causes a lot of the impact for patients who are infected. And so there are a lot of drugs being looked at to see if we can slow down that inflammatory process in people to allow there to be less lung damage. And so those are some therapeutics that are fairly wide-ranging that we have access to at Atrium Health, and we're looking at in multiple patients. And then along the lines of the plasma, one can imagine, well, if antibodies are important in this disease, if antibodies are what we are getting when we get vaccines, then what can we do to provide antibodies for people who are sick? And again, in the news over the last several days, there's been a story from a company called Regeneron, which has developed a monoclonal antibody, and they have some preliminary data out that shows for people who are either in the hospital or people who have not been hospitalized, that monoclonal antibodies are antibodies that are directed to certain parts of the COVID virus, the coronavirus, can actually help people from getting sick, or even people who are sick, help them improve quicker. So we have just started one inpatient trial with a Regeneron monoclonal antibody, and again, we'll be looking in an outpatient environment at people who have just been diagnosed, who we might be able to give the antibody to very early on so that they may not develop any symptoms, any progressive symptoms, or even people who are asymptomatic to not go on to have any symptoms at all if you're high risk. And then also there's some interesting therapies looking at people who may be at high risk, who may have been exposed in a household environment. So if one of your a spouse or a sibling or someone else living with you turns COVID positive, and you have potential risks such as diabetes, high blood pressure, heart disease, or lung disease, there are some trials looking at actually giving those high-risk individuals antibodies before they develop symptoms to try to prevent them from getting disease. So a lot of really interesting work going on. Again, happy that here at Atrium we're able to participate in those trials and bring these options and hope to our community.
Yeah, really exciting stuff. And so we're going to close out with another exciting topic, and that's vaccines and vaccines for COVID. I do know, and I'd like to promote, we do have a registry available at Atrium Health if you go on our website, where you can register to get additional information about vaccines, COVID vaccines, as well as potential to participate in COVID vaccine trials. So we'll put a link out on the resource page in case anyone's interested. But let's talk realistically, Dr. McCurdy. What do you think a real timeline is for when a vaccine will be available? And then understanding that individuals that are in healthcare and high-risk situations will, probably be vaccinated first. How long after the vaccine is available do you think it'll be available for the general public?
Yeah, so great questions. And I think, again, it's been similar to our roller coaster ride over the first 7 months of this. I think we're in the midst of the roller coaster about vaccines. So obviously there's some political sort of outcomes that may be resting on this. But I think if we look at realistic from a vaccine, so again, faster than any other vaccine before, whether it happens before Election Day or after, I think the coronavirus story has been amazing to watch. A lot of scientists looking at different types of vaccines. There have been over 100 vaccines that have been studied since coronavirus was identified. And as folks probably know on the call, that there are many in what we call a phase 3 trial now, which is looking at large populations of participants to get the vaccine in a placebo sort of structure where some people get the vaccine and some don't, and then we look at the outcomes. So with any vaccine study, the most important thing is that it's safe. And so that's why we need to put it in so many people to make sure that it's safe. And then second, obviously, we want the vaccine to work. And so because of the sort of structure of vaccine study, which is 3 phases, essentially phase 1, 2, and 3, where 1 is in animals, and then we put it into humans in a larger number, and then we do phase 3, which is the phase we're in now for some of these vaccines. It takes a lot of patience, and with these vaccines, some are one-shot vaccines series, and some are 2. And so I think we're probably looking at another 3 months, I would say at least 2 months. And I think Moderna, which is the first one that got into humans in the phase 3, they basically said sort of the end of November they're going to look at their data. And I think that's probably realistic because they've got to finish enrolling in the study and then get some preliminary outcomes. So I think we're looking probably at the end of the year, first of the year, before we start getting data around these other vaccines. And I think, again, the second question around frontline workers and high-risk individuals, I think there's a strategy nationally to try to identify who should get the vaccine first. And I think that's going to probably be a several-month rollout. So I would anticipate it sort of being available to the public in sort of the spring of 2021. And again, that's dependent on the vaccine being successful and how many there are. I think if we have several manufacturers and their vaccines are all noted to be successful, then we'll have the capacity from a manufacturing perspective to get a large bulk of vaccine out to the community.
Well, thank you so much for your time today, Dr. McCurdy. We know how busy you are. We appreciate your expertise. I do want to encourage anyone, if you have questions for Dr. McCurdy or any of our panelists or presenters today, please feel free to put them in the chat section. We do have individuals who are monitoring the chat, and we'll make sure at the end of the presentations that we get your questions answered. So thanks, Dr. McCurdy. Have a great day. Next up, I want to introduce Dr. News. Dr. News is our specialty medical director for pediatrics, and she's a wonderful woman. And she's going to talk to us today about masks and communicating with masks and some considerations that we have during flu season. So Dr. News, I'm going to turn it over to you.
Thank you, Ruth, and thank you to all who are joining us today and giving me this opportunity to share this information. Masks are definitely a new way of life for all of us, and I'm sure we're all struggling a little bit. We all process communication through facial expressions, as well as just the sound that we make. And so masks are really barriers to effective communication in a lot of ways. Some things we might take for granted: it's difficult to recognize the mask wearer when half of the face is covered, especially for children under 12 years old. They tend to rely even more so on being able to see the mouth as well as the eyes. Emotional recognition and social interaction is really informed by our facial movements, and our facial muscles are a large portion of how we communicate. Masks filter way more than viral particles. They will filter out our volume and make it less, and they filter out higher frequencies of our speech, making our voices more muffled and difficult to understand. And, you know, for those of us who care for children, whether as physicians or as teachers, it's important for us to show excitement and interest in what children are doing, and yet masks really make that a challenge. Next slide. But there is some good news in all of this. Multiple studies show us that children really can understand speech through just auditory and verbal sources. Visual cues really are not necessary for them to be able to understand. And as the adults in children's lives, we can absolutely control how we communicate with them while we're wearing a mask. Next slide. So first category is really thinking about our speech. How can we control our speech to make it easier to understand when wearing a mask? One of the clues is really enunciate, speak clearly, speak slowly. We need to increase our volume to overcome the muffling that the mask does to our voices. Exaggerate words as we're speaking. I remember being in high school and performing on stage and being told, you know, don't do anything small. Everything needs to be bigger because the people way in the back need to be able to see you and understand you. And so that's really important for us to exaggerate our normal speech. Emphasize important sounds. rephrasing is actually more important than repeating. So if a child doesn't understand what we're saying, simply repeating the phrase or what we're trying to communicate in the exact same manner isn't going to help them as much as if we rephrase the instructions and take it from a little bit different direction. And finally, as much as possible, if we can eliminate background noise. I know that's not something we always have control over, but being able to eliminate the distraction of background noise will make communication while wearing a mask much easier. Next slide. Expression. What role does expression play in how we communicate? Remember, the eyes really are the windows to the soul. And so teachers and students both can practice expression by using mirrors and really focusing on eye changes. So for younger children, having them hold a mirror and telling them, pretend that you're sad, pretend that you're happy, and getting them to focus on what their eyes look like with those different emotions is one way of helping them understand how we're communicating differently while wearing masks. It's always important to get a child's attention when we're trying to communicate with them and maintain eye contact, but that becomes even more important before we say anything, is get their attention and maintain that eye contact so that we're more effective in communicating through the mask. And for those of us who speak with our hands already, this probably goes without saying, but using gestures and body language can reinforce what we're trying to communicate. So again, using games, especially younger children learn a lot through play. And if we can turn games into tools that can focus on gestures and body language, and charades is probably the easiest one that I can think of that we could help children learn communication using different aspects. And then I kind of group things into this everything else category. So it's important to be able to narrate what we're doing. Think about cooking shows and how, somebody who's trying to teach us to make something wonderful on the Food Network narrates what they are doing as they are doing that, showing objects and pictures as we talk about them. Encouraging children to really use their words to express their emotions. I think this is a phrase all of us who work with children use on a regular basis, but it's even more important now in this time of mask wearing to encourage children to express themselves and to really use their words to tell us how they're feeling. And we as adults need to be more purposeful and more frequent in asking them to do this. Some other ways to communicate, we found experiences within healthcare that it really helped to calm patients' fears when caregivers would wear a button that had a picture of them smiling. We're all covered in layers of personal protective equipment. So in addition to a mask, there's gowns and gloves and hair coverings and face shields. And that button with a smiling picture made a huge difference in people's experience and perceptions. And it's such a simple thing for us to do. Some other things that we take for granted, maintaining the same hairstyle. Children who are maybe struggling a little bit to recognize the person behind the mask, they can actually use consistent hairstyle and even consistent clothing style as one way to help drive recognition and remove some of the distraction so that they can focus on what's being said. And another thing would be just having a mask that's personalized, and so they can recognize it as your mask or the teacher's mask is another way that we can help them communicate and overcome some of the barriers of the mask. Next slide. You may have seen clear mask advertised. Those are definitely an option, especially if there are children in the classroom who may have some difficulties with hearing, auditory processing disorders, hearing loss, etc. Any child that really relies on being able to see your lips as part of the way that they understand could benefit by having a teacher or caregiver who wears a clear mask. Just a side note, we don't really recommend wearing face shields without a mouth covering, a mask covering. Face shields by themselves do not really filter out virus and prevent significant spread. Another role that all of us has is to encourage parents and support them in this journey. They should continue normal conversations with their children at home and read with them on a daily basis as much as possible while unmasked. And that really allows the child to practice communication in different circumstances, with the mask, without the mask. Which leads me to a phrase I use all the time with parents: practice makes perfect. The more that children are exposed to something, the more opportunity they have to do or experience something, the easier it becomes for them. And the same is true with wearing masks and communicating while wearing them. We want to encourage children to continue being social. Wearing a mask shouldn't make them feel like they have to kind of withdraw into themselves. And so some of the things we can encourage are for them to wave at others who are also wearing masks, to say hello and greet their classmates or their teachers, and to practice having conversations while masked. And finally, we need to consider accommodations for children with speech delays, hearing difficulties, or developmental differences like autism. And honestly, those solutions probably are going to end up being very individualized, depending on the child's learning difference or challenge. Next slide. I added this slide actually because one of my patient's parents is a middle school teacher, and she was telling me one of the things that made her most sad about being away from her students was that she couldn't hug them, and that many of her students the most consistent hug expression of, caring and affection really was the hug they got from her at school. And so she had wondered if there was a way to do that safely in the pandemic. And I wanted to be able to share that with other school professionals. And so there really are some helpful hints for teachers who may want to hug their students. It really boils down to trying keeping the mouth and the nose separated between the two people. So hugging face to face or with both faces turned to the same side, we would not recommend. But if you're hugging and you're facing opposite directions, or if it's a younger child who can hug around the waist with us reaching down to them from above, those seem to be safer ways to hug. And so if that's been a challenge for any of our teachers, there are some ways that you can do that safely. So we're all getting ready to start into flu season, and we all know what the annual cold and flu season is like for children, and also for us as adults. So one of the things that you always hear us talk about is the importance of an annual flu vaccine. That's even more important in a pandemic like this, where there's such overlap between symptoms. So we really want to encourage all teachers and staff to get vaccinated, ideally by the end of October, because that usually is before flu season begins. And just a reminder that once somebody gets their flu vaccine, it can take at least 2 weeks for them to start building up enough levels of protection. We also want to remind parents about the benefits of vaccinating their children for all of their, not just for flu, but for all of their routine vaccinations as well. Sorry, next slide. You'll see here on this slide, there's a lot of information. I certainly am not going to read through every piece of it, but there is obviously a lot of overlap between coronavirus, the flu, a cold, and seasonal allergies. And this slide really does do a good job of kind of summarizing that. You'll notice that a lot, or actually most of the symptoms listed are listed in a teal color. And as we move to the right into flu, cold, and allergies, there's fewer teal symptoms reflecting coronavirus, but there's still a lot of them. And so it really is a challenge, not only for you as school professionals taking care of children, but for us as medical professionals trying to sort through what could be coronavirus and what could be the flu or simply a cold or allergies. There are some helpful guidelines around how long it takes symptoms to show up and how long the symptoms can last, but there continues to be a tremendous amount of overlap in all of those categories. Next slide. So in addition to kind of knowing that we'll have to sort through the contagious versus non-contagious, COVID versus other conditions, which we really are here for you as healthcare professionals and can evaluate children and determine who needs testing and when it's safe to return. But we also want to make sure that we're keeping everybody as healthy as possible. National studies have shown that most people have put off or neglected routine care for lots of different reasons during this pandemic. But yet that care remains as important, if not more important than ever before. We still encourage regular physicals and for children that they get their regular annual or more frequent well child visits. There are routine screenings that we all should be getting on an ongoing basis. This would include things like mammograms, colonoscopies, and a screening that I want to mention that you may not be as aware of is that we screen for depression across all ages. So we start screening for depression in children really in early school age all the way up through teens, and our adults routinely screen on all of their patients. That is an especially important thing for us to be looking for that I believe Dr. Hassan will speak more about. If you have a chronic condition, we definitely don't want that getting neglected. And we know that certain illnesses and injuries actually worsen if they're not treated in a timely fashion. We have lots of resources for you to access to make sure that you're taking care of all of these things. And just a quick reminder that flex spending accounts, do run out at the end of the year. And so if there are benefits that you have in a flex spending account, that's a good option for making sure that you're caught up on all of these ongoing medical needs and preventive care. And with that, I'll say thank you very much.
Thank you, Dr. Noose. Really appreciate you spending some time with us today and breaking things down like you did. Extremely helpful information. So just wanted to take a moment to thank you. For our audience today, I want to let you know that Dr. McCurdy and Dr. Noose will be remaining on the call with us till the end. We do have the Q&A chat function open. We have one question so far. We are going to bring those forward at the end of our presentation today and share with everyone. One of the biggest values of us all coming together is really comes from the question and answer section. Many of you on the call are in different phases of your return to school. Some of you are still virtual 100%, some are hybrid, and some are even back full time. And so the information and questions that you all bring forward and allow us to respond to at the end seems to be an extremely important piece of us coming together. So please feel free to add your questions in, and we'll continue to collect them for the Q&A at the end. So without further ado, we have another world-class speaker to present to you today. I have the good fortune to introduce to you Dr. Hassan. Dr. Hassan is a psychiatrist in the child and adolescent area, and she's gonna present to us today on the child well-being during COVID-19. Dr. Hassan?
Thank you. So I wanted to cover a few topics today. We know there's a lot just of change that everybody is dealing with, and one of the big things is school. So I wanted to talk about just how to navigate the virtual and hybrid learning environments, some of the impacts that remote learning may have on children, and then just recognizing some concerning mental health warning signs that may indicate that professional help is needed. So this is a big topic that I have with a lot of my patients during our appointments, and it's, well, how are you doing school? And so, you know, we have learned a couple of things that could be very helpful with just being able to navigate through the school day. So one thing is to have a designated school space. And so this can be, you know, a quiet area, and I know a lot of people are working from home as well, so there may not be as much space in the house, but, you know, it could be a desk in their bedroom. If it's a child who maybe needs a little bit more accountability, it could be in a common area where they can be monitored more, like at a kitchen counter. But it's important that this is the area that they use consistently for their schoolwork and for their homework, that you can allow them to personalize it, but you want them to be able to have that separation of the home life and school life if possible. Then as much as possible, I've been telling children to try to maintain a consistent schedule. And so, you know, a lot of times with virtual learning, kids have been sleeping until 11 or 12, and that's even more challenging if they have a hybrid schedule, because then they have one day out of the week where they have to wake up at 7 a.m. And we all know that erratic sleep schedule isn't good for anybody. So, you know, I've been recommending sticking with the same schedule, going to bed at the same time, getting up and sticking with the same day that you would at school. And so one of the ways that this can happen is by having a planner or a visual schedule, so they can make a weekly schedule with the times that they have to be at certain classes, and also just setting goals for what work that they're going to accomplish that afternoon. And visual cues are often helpful, especially for younger children. And then minimizing distractions as much as possible. So, you know, I have some teenagers say they'll scroll through Instagram while they're trying to do their schoolwork. And, you know, as adults, you know, some of us may be guilty of that as well. And we all know that when we try to do that, it definitely takes longer to get through whatever it is that we're doing. And then it's also harder to remember things. So if that's the case, they can leave their phone in another room and maybe, you know, be able to use it in between breaks if they wanted to. Another important thing is to try to build breaks into the schedule. And so, you know, if it's a 5 or 10 minute break to go outside, decompress, get some physical activity, you could always keep a supply of healthy snacks in the kitchen on the countertop, so when they have their break, they can go get a snack and then go back to class. For younger children, you want to give them more frequent breaks, maybe even every 5 to 25 minutes. But, you know, it obviously has to accommodate what the school schedule is as well. And then for older children, it's better to take breaks in between subjects or in between classes. It's also very helpful to help them maintain social connections. So if they're in virtual school, but they have some of their friends who have the same schedule, they could do a virtual lunch together, and, you know, just other social activities that are safe. Some schools are having school discussion boards and real-time like conversations between peers, so that could be helpful as well. And then as much as you can, stay in touch with teachers, because we have to remember this is new to all of us. It's new to the teachers, it's new to the kids, and as much as we can all stay in touch and talk about what's working and what's not working is helpful. And then just be flexible. You may try something, it may not work, and then you can try something different. So for hybrid learning, you know, it's really helpful to look at the school's website ahead of time. You want to know what the school procedures and policies are. They might have had changes in lunch or recess. And so basically the fewer surprises, the better. And then if you can maintain the same routine for days of in-person classes and remote learning classes, that is definitely helpful for just the structure and routine with sleep cycle. Some schools are allowing kids to have hand sanitizer and other items on their person. So if they're allowed to do that, make sure that they have those supplies if they can. And then so we've all had concerns about how is remote learning affecting kids, because we know that school is a primary driver of social lives, and it's also the opportunity for freedom of self-expression and autonomy. And then, as I've heard from many parents too, there's a lot of concern about, well, how much are they learning? Because most research does show that in-person learning on average is more effective. And some of the thought behind that is that the social environment can motivate students to engage and perform better. So I've heard different things from different kids. Some kids say they really like it. They like the absence of distractions. They have less conflict with peers. They like being able to work at their own pace. But others have reported some negative reactions, including feeling more isolated, that they just don't have that same ability to interact with friends. And then obviously without the structure, they can have an erratic sleep pattern. And so about 3 out of 10 parents have reported that they feel their child has experienced some emotional or mental harm from remote learning. And it does seem that the kids who are most impacted are those who are already at risk. So those who already maybe have food or housing instability, or there's domestic violence in the home, unsafe neighborhoods, or less social support. So, as providers and teachers, if we have a child that we are concerned about, it may be helpful if we reach out to the family to see if there's any additional support that could help them. Another thing is, people are less motivated to get up and, change and get into regular clothes. I'll have a lot of patients tell me they stay in their pajamas all day. But with isolation from peers, lacking the normal sleep schedule, and then not having that normal hygiene and grooming pattern, the depression can be exacerbated. And then there can be a lot of anxiety about schoolwork. I've had a lot of kids tell me they feel like their workload is too much. They're just getting assignment after assignment, and they're worried that they can't pay attention, or they feel like they have less instruction. So there's a lot of anxiety around just the different work that's being done. And one way, though, to flip this that we can talk with kids about is, whatever jobs they have, they're probably going to have more virtual meetings, more virtual interaction, maybe even more work from home options. So we could talk to them about how this is a time to try to figure out what works for you and what could help you in your future. Next slide. So here's some strategies. So we talked about all of the concerning impact of remote learning. So here's some strategies to try to help with that. Definitely meet regularly with teachers. Again, just to talk about what's working, what's not working. There can be 504 plans that can, allow for different accommodations for the students as well. And some schools are scheduling peer meetings, and so it can be a moderated talk, but it's a live chat option with their peers. And maintaining social connections, checking in with friends, safely seeing them with the appropriate distancing. And then you want to have regular check-ins and communication with your child. So, just basic, how are you doing? Let's just talk about how your day has been, and then you can help them with some mindfulness exercises. So for younger kids, this can be things like just different deep breathing exercises, muscle relaxation strategies, blowing bubbles. And for older kids, there's some different mindfulness techniques that can be helpful. One that I've heard a lot of patients say they really like is, it's really simple. They just talk about 5 things that they can see, 4 things they can touch, 3 things they can hear, 2 things they can smell, and 1 thing they can taste. And what that allows them to do is be able to be mindful of their anxiety and kind of recenter them and focus on the present moment. So that can be a helpful technique. And again, another concern everyone is having is, this is for all of us, adults and children, we all have so much more screen time than we did before. And so, is there going to be any long-term impact of this? So I think the first thing we all have to do is try to remind ourselves that we're living in a different environment, so we have to make different choices and follow different rules. And there's very little evidence that actually connects screen time to harm in kids. The bigger problem is if screens replace other activities like exercise, socializing, and sleep. So the first thing to do is just to try to be flexible, to remember that At this point, screen time is more than just entertainment. It's interactive. It's the way that we are able to engage with our loved ones, like grandparents and friends. It's also obviously very important for learning. But then, so there's the social aspect, there's the learning aspect, and then kids can do different things online than they've done before. You can do virtual tours of museums, they can do exercise videos. So there's a lot of variety in the screen time that can be beneficial, but it's also very important to have dedicated time for non-online activities too. So one suggestion I've made with some of my families is to have at least one media-free meal. So everybody puts away their phones and their tablets and just engages and talks with each other. And this can be at any point during the day. And some teenagers I've talked to, because they know about intermittent fasting being the fad right now. So we've talked about making this into more of a social media fasting. So intermittent social media fasting for the family, maybe have designated time in the evening that there is the electronics are not allowed from like 6 p.m. to 8 p.m. And then just having some fun activities to do together, like make dinner together, maybe have everybody has a night where they pick what is going to be for dinner. Maybe they're in charge of it, obviously with older children, for the evenings, play some board games, go for walks. So just some different fun activities that engage the entire family. But I think we all just need to remember to give ourselves permission to relax. We can have different expectations now. This is a stressful time, and we don't need to add on to the stress with worrying about screen time. So we all have to do the best we can, and again, allow screen time and just try to incorporate additional activities as well. And then some of the warning signs that we need to be aware of that are concerning in children can be, some of the things that are listed on the slide. A lot of times kids have difficulty telling you that they're feeling sad, and it comes out a lot in behaviors and just different statements that they make. And so some things to look out for are changes in behavior or mood. So do you have a normally calm child who suddenly is having these rage episodes, or a child who usually gets along really well with their friends and they're suddenly having a lot of fights and conflict with their friends, or they're normally texting a lot, but now they're spending a lot of time quiet and withdrawn in their room? Changes in appearance are important too. So is this a kid who usually, was really invested in their appearance, and now they're not doing their basic hygiene or brushing their hair, or brushing their teeth? And so those are all things to be aware of. If you feel like your child is expressing any hopelessness, or they're having excessive crying episodes, they're seeming more irritable or anxious. And a lot of times they won't tell you that they're anxious, but they'll start having some physical symptoms of anxiety, like headaches or abdominal pain. There can be a lack of motivation, not wanting to get up and do virtual school, just being tired, wanting to sleep a lot, and any changes in sleep or eating are concerning. And then if they start avoiding activities that they previously enjoyed, like playing an instrument or playing basketball, doing crafts, and then being concerned about just any risky behavior, so any drug or alcohol use. So these would all be things to consider reaching out for some additional support. So here's a list of our mental health services that we have at Atrium. We have a psychiatric emergency room that is available 24/7. It's staffed with psychiatrists, and then we also have our inpatient unit for kids who have any acute safety concerns. We have our outpatient medication management and therapy clinics, and we have our partial hospitalization program, which is for kids who are, they need a little bit more intensive treatment than traditional outpatient treatment. We also have school-based therapy services, which are still taking place, and it's virtually within 19 of the Charlotte-Mecklenburg schools. And here are the numbers on how to access the services through Atrium. We have our behavioral health call center, which is staffed 24/7. And then if you want to know how to access school-based therapy services for your child, Donnie Mitchum is our lead therapist, and she's a good person to coordinate with, and she will help direct you to the school and how to make that referral. So those are all the topics that I have to cover.
Thank you so much, Dr. Hassan. Again, fantastic information, and we really appreciate you taking the time to share it with us today. And thank you for holding on. I know you're going to hang with us to the end of the call to entertain any questions. So thank you once again. I am actually Megan Heyer, who is going to facilitate the Q&A session. And we do have a question, and I'm actually going to pose this to Dr. Noose. Dr. Noose, will the regular flu vaccine have any positive impact on COVID-19?
Thanks, Megan. So there's not a direct positive impact. So the flu vaccine wouldn't give any cross protection against COVID, if that makes sense. But really, our hope is that getting the flu vaccine decreases the chances of getting COVID and flu together. So we know, for instance, that when our immune systems are fighting one infection, we are also vulnerable to picking up other infections along the way. And COVID in particular seems to occupy our immune system and lower some of our immune fighting factors in a way that would make it easier for us to get flu. And we don't really know the full impact of what having COVID and flu together would look like. Given the real severity of COVID just by itself in many of our patients, the coexistence of a flu infection could be devastating. And so we're really hoping to avoid that as much as possible by preventing widespread flu activity. And the flu vaccine is our biggest weapon for prevention of that. And that's why you're going to hear all of us talk a lot about the extra importance of getting a flu vaccine this year.
Great, thank you so much. Another question, this one is for Dr. McCurdy. Dr. McCurdy, we talked a lot about vaccines. Is there any information on peds or pediatric vaccine versus adult vaccine work that's going on, or is it all kind of together in this broader vaccine work that's going on? Do you have any information to share on that?
Yeah, so Megan, everything's pretty early on in the vaccine world. So typical for most vaccines, this sort of targeted group initially is sort of adults who are healthy. And so again, I don't have access to all the protocols for all the vaccines that are in clinical trial at this point, but that's usually the targeted group where we start. And then after a little more experience with that, there'll be some more specific vaccine trials for the pediatric population, and then sometimes even some more targeted trials for elderly patients in particular.
Great, fantastic. Thank you so much. And then another question for Dr. Hassan. You know, we spent a lot of time talking about the impacts of screen time on children and the virtual learning environment. One of the things that really comes to mind when we have an audience like we do today is, you know, our teachers also are spending a lot of time on the computer as well and in front of the screen. How does some of the recommendations that you gave us for the kids and watching the kids' emotions and that anxiety and feeling overwhelmed, how does that translate to maybe our teachers and faculty and staff members in our schools?
Well, that is a good question. And, you know, I think as adults, sometimes, you know, we are better able to recognize if we're starting to feel burned out or if we're feeling, you know, more irritable or anxious. But I think, you know, trying just to be aware, take a few minutes a day to, you know, try to kind of check in with yourself and see how you're feeling. And then some of the same things that we suggest to children are important for us as well. You know, make sure that you're doing other activities, that you're getting a mental break from school and from this whole new environment that everyone is dealing with. So, you know, the regular routine, exercising, spending time with family, and just doing other activities that are safe as well.
Thank you so much. So I'm going to ask one closing question, and I'm going to direct this to Dr. Noose. Dr. News, with our teachers going back to school or preparing to go back to school in some cases, as well as our other faculty and staff members in the school system, there's some level of anxiety about going back. If I'm an employee going back and I have some anxiety, can you give me maybe 1 or 2 tidbits on how I can understand where my anxiety is coming from and any guidance on how to address that?
Yes, I'll do my best. There are a few things. I think it's being self-aware in times like this is really important. So being honest with ourselves about our anxiety and where it comes from is the first step. And then information is power. So once we understand what our fear is, being able to know kind of the facts and the data behind that, I think can really help calm fears for a lot of people. Conversation is key, being able to share those fears and those anxieties with coworkers, with family members. All of that helps us cope with those anxieties. And a lot of the tips that Dr. Hassan shared are applicable to us as adults as well. My biggest advice would be none of us are alone in this. We're all in a period where a lot of the things we deal with day to day are unknown, and that leads to increased anxiety. And so we should never hesitate to ask for information and to ask for help and to accept it when it's available. And if there are, questions about, a lot of people are fearful about, well, what if I get COVID? I hear about people dying. We as medical providers have a lot of that information, and we're absolutely happy to talk through those things with people.
That's great. Thank you. And I was just wanting to play off of one of the comments you mentioned about the hugging question. I thought that was fantastic. And just opening the door for all of you on the call. If you have questions or concerns, we are here for you. We will make sure we get your questions to the appropriate subject matter expert in the Atrium system to help you. You are not alone. We are all working through it together. So we're at time, so I'll close us out and thank everybody for joining us today. The next town hall will be in early November. And remember that there are email information on the next slide. If you would like to ask questions specific to you or suggestions for topics on the next town hall, you can email k12covid@atriumhealth.org. And also remember to visit the atriumhealth.org/schools for any of the most updated information. Thanks everybody for attending, and thank you all of the speakers for spending time with us today and sharing such great information. Have an excellent Thursday. Thank you.